Good evening. Welcome back to our series on the professional exams made easy. Uh, we have been discussing over a lot of important topics for your university exam, which is upcoming in the month of September or probably late August. And we had discussed most of the gross anatomy topics all this while. What we'll do today is we'll try to focus on some of the important short essays that are asked from the topic of general embryology. Very often we see that most of the students, even when we were like students, we would have ignored and neglected the topics coming from embryology, histology, genetics, and now for you, the AdCom also, right? So these are the topics which are like very limited. The very limited questions come from these topics. And if we are thorough with our preparation with these topics, like 8 to 10 marks from embryology, 8 to 10 marks from histology, like are guaranteed. So what we'll do today is we'll just try to visit some of the important questions that could be asked from general embryology. And we'll also see some of the important questions for which how to structure the answer, because this is where most of us actually find difficulty. Gross anatomy, the headings are given in the book, it's a lot more easier. Embryology and histology are not like that. Okay, so let's get started with today's session. And first, we'll again try to see some of these important topics which we need to be prepared for, right? So we will focus on general embryology today, and Monday we will focus on the topics from systemic embryology. Starting with the pre-fertilization events, the first question that we need to be prepared for is the spermatogenesis, right? Remember, questions from embryology are most likely to be 5 markers or 3 markers. Very rarely we have seen questions which are like long essays. I still remember once in RGHS, we had a question from development of the respiratory system. But I think apart from that, we have not seen long essays coming from embryology, right? Some of the universities in their blueprint would include general embryology from which long essay can be asked, right? So the first important short essay that we need to be prepared for is spermatogenesis, right? Now, if spermatogenesis is asked, how we would approach it, let's try to understand, right? So if spermatogenesis is asked, so we always begin with trying to define what exactly is spermatogenesis, right? The definition of it. Then the timeline, right? When exactly the spermatogenesis begins, right? Then what is the site where exactly the spermatogenesis occurs? For example, seminiferous tubule of the testis, right? Then what about the duration? So for how long spermatogenesis will occur? The process of spermatogenesis will occur for about 64 days, right? Now, how these 64 days are divided into 3 stages, right? The stage of mitosis, meiosis, and spermiogenesis. What is the duration of each of these stages? And then how each stage proceeds to the next with the help of a flowchart or a simple diagram, right? This is what we need to write. And possibly in the end, we can end it with what about the clinical importance or clinical significance of knowing about the process of spermatogenesis, right? So this is how we can approach the spermatogenesis topic. 5 marker with these 5 headings and a simple flow chart where we explain the stages. This is where most of the marks goes, right? So explain this with the help of a flow chart or even a simple diagram, starting with spermatogonia, ending with the mature sperms. Then in the topic of spermatogenesis, we have one sub question, that is the process of spermiogenesis. We all know that spermiogenesis is a morphological change, right? It is not cell division. It is just a morphological change wherein the round spermatid is converted into the mature spermatozoa. So what are the morphological events that occur during spermiogenesis is what we need to write. Okay, again. So what we write here is we start with the definition. Then we talk about the duration, right? What is the duration of spermiogenesis? Then we talk about the morphological changes, right? So we talk about the morphological changes that occur during spermiogenesis, where each cell organelle will get converted into one of the important part or component of mature spermatozoa, right? Are we clear? So this is what we need to write in spermiogenesis. Again, one simple diagram where we show a round spermatid getting converted into a tail-like spermatozoa. This is what we need to show, right? So remember, this could be a 3-marker, or we can also get match the following type of MCQ in this. So they'll give the cell organelle and they'll give the component of adult spermatozoa. What component comes from what cell organelle is what is usually asked. Are we clear? So this is regarding the spermiogenesis. Then oogenesis. One more important 5-marker. Okay. So unless specified, so all these questions are 5 markers. I'll repeat again, right? Oogenesis, again, we start with defining what it is. Then timeline. When does oogenesis begin? Right? Oogenesis is peculiar from spermatogenesis in being spermatogenesis begins at puberty, whereas oogenesis begins when the female fetus is still inside the uterus. Right? So there is a prenatal stage, there is a postnatal stage. Right? So timeline. Then where does it occur? Then the duration. What is the duration of a single cycle of oogenesis? Spermatogenesis, 64 days. What about oogenesis? Remember, oogenesis is quite a long process, right? It begins before birth, then it continues till the onset of the first ovarian cycle, and then the end of menstrual cycle or the menopause, right? A single ovarian cycle or a single cycle of oogenesis can last up to 45 years, right? This is the peculiarity. Then in the stages, we mentioned 2 stages. What are they? One is prenatal and the other one is postnatal. So we describe it using a simple flow chart, right? And then again, of course, we talk about the clinical importance. So this is how we need to structure the answer for the oogenesis process, right? Again, as I said, a very important 3-marker. Nowadays, they ask questions like compare, right? Compare and contrast. Okay? Compare and contrast the process of spermatogenesis and oogenesis. How do we write for that? So make 3 columns, right? So what we'll write? First column, talk about what are the feature you're trying to compare. Spermatogenesis, oogenesis. So compare the same headings. That's it, right? This is how you need to approach answering general embryology question. Are we clear? Right. Then the structure of a spermatozoa or a secondary oocyte. What we need to do here is practice diagrams for the structure of spermatozoa and secondary oocyte. Right. One diagram for spermatozoa where we show the parts with the measurements. Right. And one diagram for secondary oocyte where we again draw the oocyte, label the parts of the secondary oocyte or the mature oocyte. Done? Right. Then capacitation. This could be a 5-marker or a 3-marker. Right. Now, what do we write in it? Capacitation, again, what exactly is capacitation? Where does it occur? When does it occur? Right? And for how long does it occur? Right? Capacitation takes place for about 7 hours. It occurs in the female genital tract. Then, what are the changes? What are the changes that occur during capacitation? You have 5 headings, right? Now, in 5 headings, if you can describe capacitation, nothing like it. Okay. Then, what is the clinical importance? Remember, uncapacitated sperms can never fertilize the oocyte, right? Even in vitro fertilization, the spermatozoa need to be capacitated, right? So this is the clinical importance. So 3 marker, 6 headings, 5 marker, 6 headings, nothing like it, right? So this is how you need to structure. Then when it comes to fertilization, what do we do in fertilization? Again, let's say we start with definition. What exactly is fertilization? The process of combining of male and female gametes. Of course, your textbook gives a complex definition, but even a simple definition would do, right? Then, where does fertilization occur? Let's say the ampulla of the uterine tube. When does fertilization occur? If fertilization occurs, it usually occurs within 24 hours of the ovulation, right? Because oocyte is viable only for 24 hours, whereas spermatozoa is viable up to 48 hours. So this is the timeline, right? Then what is the duration of fertilization? Fertilization usually the process lasts for about 24 hours, right? Then what are the stages, right? The stages are compared to the 3 barriers the spermatozoa need to penetrate. Okay, so that we need to mention the stages of fertilization. Then, what are the effects of fertilization? Both of these, again, these are 3 marker in themselves. Okay, stages of fertilization, effects of fertilization are very often asked as important 3 marker questions. Done. And then we can again end it with, let's say, clinical implications or clinical importance. What is artificial fertilization, right? This we can explain. In vitro fertilization, what is it? We can explain, right? Done. Then the next important topic we have is implantation. Again, so what exactly is implantation, right? The process of embedding of the product of conception in the upper uterine segment. This is what we call as implantation. So what is the normal site of implantation? Normal site of fertilization, normal site of implantation, both of these are important MCQ questions, right? Are we clear? Then once we write it, what is the timeline? When does implantation begin and when does it get completed, right? So implantation, remember, usually starts by the end of the 5th day or the beginning of the 6th day after fertilization. It gets completed only after 12 days. So that is what we will write in timeline. Okay. What about duration? Remember, the entire process of implantation from beginning to completion takes roughly about 7 days, right? 6 to 7 days. Then the process. We need to explain the process of implantation. Then we need to talk about the clinical importance, where we will speak about the ectopic pregnancy, right? So this is how we write. Done? Okay. Now, these are some of the important questions that can come from the pre-fertilization events and the development during the first week. I've listed everything together. Okay. Now, we will discuss few questions separately, but I wanted to make sure that we will discuss all the questions asked in general embryology and give you the heading so that you can build on the answers. Again, I'll repeat, the deficiency in your content can be replaced or it can be compensated by the way you present your answer. And this structuring of the answers will definitely help in your university exam. Apart from this, what are the other important topics, right? When we come to the development during first week and second week, morula, right? Again, I would say this is a 3 marker question, right? We don't see it as like a 5 marker question. This is a 3 marker question. Okay. So what do we write? Definition. What exactly is morula? When exactly it is formed, right? These are the 2 things that we need to do. Then what is the next stage after morula, right? So morula refers to the 16th cell stage, which is formed usually at about 72 hours after fertilization. This stage progresses to blastocyst, right? Why it is called morula? Because of its appearance to a mulberry. right? So 3 marker, this is what we need to write, nothing beyond it. Then blastocyst, I would say this is an important 5 marker question for you, right? Again, what do we mean by blastocyst, right? When exactly it is formed, right? What are the types, right? In types, we have the early blastocyst, we have the late blastocyst. Then, what are the parts? What are the derivatives, right? For example, we know that if this is a blastocyst, right? So we have the inner cell mass, which is also called as the embryoblast, the outer cell mass, which is also called as the trophoblast, right? The early blastocyst will have a covering of zona pellucida, whereas the late blastocyst will not have zona pellucida. Disappearance of zona pellucida will result in implantation, right? So parts, derivatives, and once we have done this, probably ended with clinical importance, right? Very often we think that what is there to write in blastocyst? Okay, see how much we can write actually for the topic of blastocyst. Done. So this is how we need to explain the blastocyst. Done. Right. Then the next important question is week of twos. How do we summarize the changes that occur in week of twos? What happens to the trophoblast? What happens to the embryoblast? What happens to the development of fetal membranes, fetal cavities, the extraembryonic mesoderm? All these need to be summarized. Sometimes this is asked as a 3 marker question. Explain the week of twos. Summarize the changes that occur in week of twos or second week of development. Okay. The second week of development is also called as week of twos. Is the statement true? Justify. Okay. So this is how the questions will come, right? This is regarding the week of twos. Now, primitive streak, notochord, we will take up as separate questions. We will discuss about it. We'll take it up as separate question. Now, what about gastrulation, right? So what exactly is gastrulation? When does it occur, right? Then what is the process of gastrulation, right? Then when gastrulation happens, what is its clinical importance? This is how we need to explain the gastrulation process. Now, in all the questions we have discussed till now, I would say, if you observe, we have always talked about the timeline. Very often in embryology, we easily neglect this, right? When exactly this development is happening, when exactly this change is occurring, this is what we tend to forget. Please don't do it. Okay? This is how you need to cover it. And this is how you need to mention it in your exam and highlight it. Okay? Remember, this is where you will score over others. Done? Then, if new relation is asked, again, I would go by the same headings. Define what is new relation, when exactly the process of new relation will occur, right? Then, what is the process of new relation? Explain it. What are the types of new relation? Then, the clinical importance, where I will talk about 2 important defects. One is the cranial neural tube defects, right? And the other one is the caudal neural tube defects, where I will talk about the spina bifida, right? So this is how we will describe the process of neurulation. In neurulation, one more important thing that we can add is, once we describe the type, the derivatives of the neural tube. Now, this is why I say when we look at the questions from embryology, we always feel that there is nothing much to write. But if we go back to what we have studied, like if we try to structure the answer, this is how you can expand your answer, right? This is regarding neurulation. Neural crest cells, again, start with definition. What is neural crest cell, right? Again, possibly when exactly these neural crest cells are formed, right? How exactly neural crest cells are formed? What are the types of neural crest cells? Remember, in neural crest cells, all that we remember is derivatives. We go on mugging up the derivatives of neural crest cells. Now, if it comes as a 5 marker, again, we are stuck only at what are the derivatives. We'll be able to list 5 or 6 derivatives and nothing beyond that. But this is how you should describe it. What are neural crest cells? Neural crest cells refers to the tip of the neural folds, right? When exactly they are formed? They are formed during the 4th week of development. How they are formed? They are formed by the completion of the process of closure of the neural tube. What are the types? Based on their location, we have cranial, then we have the cervical, then we have the truncal, right? So there are different types of neural crest cells we need to mention. Then we need to talk about the derivatives. When we talk about derivatives, we need to talk about derivatives of each group separately. What are the derivatives of cranial neural crest cells? What are the derivatives of truncal neural crest cells? Right? This is how we need to describe. Are we clear? So this is regarding the neural crest cells. Right? Done. This neural crest cell is also a favorite topic of your paper setters for MCQs. Done? Right. Then the other important topics that we need to prepare, right? The derivatives of germ layers. This I would say is a 3-marker question or an MCQ question. What are the derivatives of ectoderm? In ectoderm, what are the derivatives of surface ectoderm, neurectoderm? What are the derivatives of mesoderm? What are the 3 subdivisions of mesoderm? The paraxial mesoderm, intermediate mesoderm, lateral plate mesoderm. Each of these derivative of mesoderm is an important 3-marker and an MCQ question, right? So please be prepared for at least listing of 8 to 10 derivatives for each of these germ layers, right? If you remember 8 to 10, you would be able to recall at least about 5 to 6 in your exams, right? Then derivatives of endoderm. In derivatives of mesoderm, one question they often ask is regarding somates, right? What are somates? What are the derivatives of somates, right? So this is what they will ask. Definition of somates. Somates are segmented structures which come from paraxial mesoderm. Now, if somates are asked, how do we describe it? Okay, again, try to define what are somates, then try to describe when exactly the somates are formed. Okay, then talk about the numbers and formation. So when exactly the first pair of somates appear, how 4 pairs of somates get added every day until we have 44 pair of somates by the end of 30th day. Then what are the derivatives of somates? We know that somates will divide into 3 parts: sclerotome, dermatome, and myotome. So what are the derivatives of sclerotome? What are the derivatives of dermatome? And what are the derivatives of the myotome? This we need to mention for the derivatives of somates. Are we clear? So this is how we will describe the somates. Then development of placenta, right? This is again an important 5-marker question. So in development of placenta, what do we do? First, we try to define what is placenta. Then we talk about when exactly the placenta starts forming. Then we explain the process, how exactly the development of placenta begins. Now, in this process, we will try to describe the formation of the primary villi, secondary villi, and tertiary villi. We try to describe the parts of the placenta and describe the structure of each of these villi. Then, here itself, we will talk about the placental barrier. Okay. Now, remember, this placental barrier in itself is an important 3-marker question. What is placental barrier? How does placental barrier in early pregnancy and late pregnancy differ? What are the components? What are the functions? Then, what are the functions of placenta? right? What are the functions of placenta? Then, what are the abnormalities of placenta, right? What are the placental abnormalities? What are the different types of placental abnormalities based on, let's say, the attachment? Okay. When we talk about attachment, we usually describe one important condition. And what is that? We call it as placenta previa, right? Now, this is a very important three-marker question where we need to talk about what is placenta previa, what are the different grades of placenta previa, right? Now, this is again a very important three-marker question. Are we clear? Right. Then placental barrier, as I said, this is a subtopic in the development of placenta. This is an important three-marker question, right? Where we need to define what is placental barrier, then when exactly the placental barrier is formed with respect to early placental barrier and late placental barrier. Then the types, where we discuss about the two placental barrier again, the early type and the late type placental barrier. Then the components, how exactly the placental barriers are formed, what is its function. This is how we need to describe about the placental barrier. Are we clear? Right. Then this is one topic that again most of us would skip. But I would say this is a topic that is like undermined in general embryology, the topic of twinning, right? This could come as a bouncer in your exam, right? You go prepared for all the topics. One topic that can come out of like let's say out of syllabus or as a bouncer is the topic of twinning, where they can suddenly ask you about what is twinning, what is the mechanism of twinning, what is the type of twinning, what is the embryological basis behind the conjoint twins, what are the different types of conjoint twins. MCQs can be framed on the different types of conjoint twins, right? Now this could come as a surprise for you in your exam, right? Now, this is one topic that I suggest you need to be prepared for, right? The topic of twinning, apart from any other topic that we just discussed. Are we clear? So this is regarding some of the important topics that we need to be prepared in the topic of general embryology, right? We have discussed and we have covered almost all the topics that are like very frequently asked in your general embryology. But apart from this, as I said, we did not discuss few topics which need to be discussed in detail, which are important 5 markers. And fertilization, I think we discussed, right? So this is how you describe and explain the process of fertilization if it comes as a 5 marker question. Again, I'll repeat the stages of fertilization, the effects of fertilization. These two are often asked as 3 marker questions, separate 3 marker questions, right? Site of fertilization, site of implantation, definite MCQs. Okay. Then primitive streak, right? As I said, this is one topic again, which we would have read, but we don't know how to describe it. So when primitive streak is asked, always start with what exactly is primitive streak, right? Then when exactly the primitive streak appears, right? When exactly the primitive streak appears, right? The primitive streak appearance marks the beginning of gastrulation. Let's say the primitive streak appears on the day 15 after fertilization. Then when does the primitive streak disappear? More than when does it appear, we also should know when does primitive streak disappear. Once it performs its function of gastrulation, when does it disappear, right? Then we need to describe the entire process of development of primitive streak. How the primitive streak appears as a midline thickening in the caudal region of embryo. Then how does it give rise to the primitive node? Within the primitive node, how does it give rise to the primitive pit? From the primitive pit, how the cells migrate first replacing endoderm, then forming ectoderm, also mesoderm, right? This we need to describe in the process of development. Then, what exactly are the functions of primitive streak? Why do we need primitive streak? What is the fate of primitive streak? Primitive streak, as we know, disappears. When does it disappear? If it does not disappear, what are the clinical significance associated with it? What are the embryological anomalies? For example, remember we have the sacrococcygeal teratoma, right? So what is sacrococcygeal teratoma? The sacrococcygeal teratoma refers to if the primitive streak does not disappear by day 26, if it persists, it gives rise to a tumor in the sacral region, which is called as sacrococcygeal teratoma because the cells of the primitive streak are pluripotent. What do we mean by this? The cells of the primitive streak can give rise to the derivatives of different germ layers. So in the tumor, we have the derivative of ectoderm, endoderm, and mesoderm. For example, the tumor would contain muscles, mesodermal derivative. It would contain glands, an endodermal derivative. It would contain hair, nails, teeth, which comes from the ectoderm, right? So this is what sacrococcygeal teratoma means. This occurs due to the late disappearance or persistence of primitive streak. Now, one condition which again we often ignore, if the primitive streak disappears early, right? If it disappears early, it leads to one important clinical condition. And what is that? Remember, that is called as uh, just a minute. So what do we call it as? We call it as sirenomelia, or we call it as what? The caudal dysgenesis, right? Very commonly called as the mermaid deformity. This occurs because of early disappearance of the primitive streak. Are we clear? So this is what we need to describe if primitive streak is asked. In the same manner, one more question where we often find difficulty in general embryology is if this is asked, that is the notochord. So we will not know what to write. Okay. So what is notochord? When does the notochord form? How does the notochord form? What do we mean by the primitive notochord? How primitive notochord gives rise to the notochordal canal? After this, how it gets converted into definitive notochord? Once it gets converted into definitive notochord, what are its functions? Once it subserves the function, what exactly is its fate? Most of the time, we end up writing notochord gives rise to the vertebral column, which is absolutely false, right? The axial skeleton is a derivative of sclerotome, which comes from somite, right? Now, this is where we go wrong. Okay, so notochord and primitive streak are two important short essays which you need to be prepared for every embryology exam you write. Okay, so what is the fate? What happens to notochord after it is formed? Does it persist? If it persists, what does it persist as? Right? What part of the intervertebral disc actually comes from notochord? What part of the ligaments of the atlanto-occipital joints come from this? Right? This we need to mention. Then, what is the clinical significance? If notochord persists, it gives rise to a condition called as chordoma. What is it? This is what we need to explain. Again, primitive streak or notochord will not be asked beyond 5-marker question. This we need to be prepared for. Are we clear? Right. So this is regarding the topic of notochord. Done? Now, these are some of the important questions that can be asked from the topic of general embryology, right? As I said, what? We have about like 12, 15, 5 markers and 3 markers that we need to be prepared. Now, if we had known this, let's say during our time, we would have invested time in this, right? Now, we often ignored embryology topics by looking at, okay, 8 marks come from embryology. Why read it? But remember, we had very limited topics. Even today, if you sit for like, let's say 3 to 4 hours, you can cover all these questions. Okay. And all that needs during your exam is possibly half an hour of revision where you need to just turn pages, go through the headings. If this question comes, these are the headings under which I will describe this answer for general embryology topic. This is all that's needed, right? So please do not ignore general embryology and systemic embryology, because embryology alone will account for about 20 marks, including paper 1 and paper 2. And again, I'll repeat, these are limited topics compared to the sheer volume of gross anatomy. The embryology and systemic embryology portion, general embryology and systemic embryology portion that you need to undergo, like study, revise, is very limited. So please be prepared for these topics and you will score well in these topics, right? So with this, uh, before we close, if you have any questions, we will take up, or else we will come back again on Monday where we will discuss about some of the important questions that actually come from systemic embryology, right? Uh, any questions we will take up, or otherwise we will close the session here and we'll come back and join on the next Monday.
Thank you, sir.
Yep, sir.
Recording
Bye,
stopped.
sir.